Hey guys, it's Dr. Watt from Pinecrest Chiropractic. Let's talk through TMJ dysfunction. So I'm going to use my friend Jerry here. He's going to help model some of what we're looking at. So let's talk first the anatomy of the TMJ. Well, your TMJ stands for temporomandibular joint. There's a joint on either side of our jaw that is responsible for hinging, and there's actually a little bit of a glide in there as well. What that does is allows us to open our mouth. This is one of the most used joints in our entire body. Every word we say, every bite we take, we're using this all day long. And so the mandible sits right here in this groove in our temple. In between there, it may be hard to see here on Jerry, but there's a disc. This is one of the few discs that are outside of our spine. There's a couple of them in our body. But this disc in the TMJ joint is responsible for cushion in between the temple and the mandible. On top of that, there are 4 muscles of mastication. That's just fancy words for muscles to chew. And so 2 of them we can see from the outside of the skull. The one is your masseter. This is the one most of us think of. This sits right here on the side of our jaw. You can feel through there, and if you have some TMJ issues, you're probably gonna find a couple knots and trigger points. Might even be a little bit tender. So that's muscle number 1 is our masseter. The other one we can see on the outside is our temporalis. This sits right here. If you clench your jaw, you can feel that muscle pound there a little bit. It's a really thin muscle that inserts down here on the jaw. So those 2 are both on the outside of the skull. The other 2 are in behind the mandible. So in Jerry, I'm gonna flip them upside down. We're gonna see those in through this area here. Those are called your pterygoid muscles. There's a medial, which means middle, and a lateral, which means outside. So it's right on the inside of the mandible here. Those 4 muscles are all responsible for moving the jaw all day long. Fun fact, only one of them is actually responsible for opening the jaw. The other 3 are all responsible for closing. So we have a much stronger close than we do open. And so that takes us through some of the anatomy that's going on with our TMJ. How do we treat this though? What do we look at when we do an exam? Let's talk through some of that stuff. Well, every patient who comes in our office, we're of course still going to go through a full consultation and talk through all of the symptoms that you're getting. Is there clicking, grinding, popping? Is there pain? When is there pain? How long has it been going on? All of that type of information we're going to pull on out. As we move into an exam, one of the first things we're going to do is check your cervical spine. Your spine inserts onto the bottom of the skull here, and your cervical spine is deeply related with your TMJ. If you've got issues in the one, most likely you're going to have issues with the other. So we want to make sure we're ruling all of that out and covering our bases. So once we move through a full cervical spine exam, we're going to examine our TMJ more closely. First thing we're going to do is palpate through those muscles. Like I said, if you've already got issues, you know it, you can feel through that and probably feel a few knots and trigger points. So we're going to try and identify those. Next thing we're going to do is actually feel the joint itself. And so we're going to put our fingers right on that joint. As you open and close your jaw, we're going to feel how it glides. And there may be dysfunction on how the right versus the left moves. The other thing we'll be watching for is if you watch Jerry as he opens his mouth, his jaw goes straight down. If you're suffering from TMJ issues, your jaw will probably do what his just did, where it'll shift to the side as we open or close. It'll kind of make like a big C curve or even an S curve where it goes out to the side or glides down, meaning there's imbalance in those muscles of mastication left to right. So we need to know that as we palpate through those joints so that when we start to treat, we can treat the right muscles, creating a better imbalance, and then strengthen them appropriately. All of these things are things that we're going to look at when we go through a full exam on you and your TMJ issues. If you want to go more in depth and talk more about your specific issues, come chat. I'd love to hear about it.